This is Holly Hatch, Director of Behavioral Services for the New England Heart Center, and I'm here with Doctors Sinatra and Lowen, and we're talking about sexuality and the heart. And I'd like to start off by asking Steve, is there really a connection between sex and the heart?
I mean, is there really a connection?
Is there really a connection? Right.
Well, Holly, there is. I've been a cardiologist now for 15 years and a therapist for about 10, and I never realized a connection until Dr. Lowen and I did a workshop together a few years ago. And the bottom line is that men who really do not feel sexuality or just feel really render themselves susceptible to heart disease. The cardiac patient in general denies feeling or suppresses feeling and really doesn't want to feel or acknowledge any feeling. And this is done on all levels, including the sexual level. But what I'd like to do is have Dr. Lowen answer that question. He is the author of Love, Sex, and Your Heart, his most recent book, and he's written some bestsellers, One, Love, and Orgasm, about 20 years ago, and he's probably the world's authority on sex, and I would say on sexuality and the heart as well. So Dr. Lowen, can you answer that question, please?
Well, I can say this. Sex is known to be the great releaser of stress and tension. And, I mean, that's its natural function. Reich defined it as the fact that sex balances the energy in the organism, because if you get charged up through sex, you can really discharge that tension, that excitation, etc. Now, if you haven't got that discharge function available because of the lack of good sex, good, discharging, orgastic sex, then you're going to build a lot of tension into your body. And the tension is going to build mostly in the heart. Because you ask, is the heart connected to sex? Well, then we should say, really, is love connected to sex? And if love is connected to sex, then the heart's involved. You must also realize, of course, that the sexual excitation arises because more blood flows into the sexual organs. And that comes directly from the heart. So here that heart is pumping the excitement right into your sexual organs, creating tumescent. Question is, what do you do with it? How do you handle it?
One of the things that I hear from my patients, especially my type A coronary prone individuals, my high performance, high achieving population, is that sexuality doesn't enter their lives because they're too exhausted. In other words, they don't have the energy for sexuality.
Right.
Can you just discuss that a little bit? In other words, you need energy to have sexuality. I think Reich talked about this also.
Sure. Well, see, sex itself is a function of discharging and excitation. And if there's no excitation, then there's nothing to discharge. There isn't any charge into the sexual, function. The question is, what do you do with these people?
People who are exhausted, who are totally exhausted to really appreciate sexuality.
Well, there you have to treat them as a person. You have to say to them, well, look, aren't you a fool working all your life and miss all the enjoyment? Put it that way.
In other words, just really put it out there.
Of course.
In other words, you're not playing. You're not taking any pleasure in life.
No. It's not playing. It's that you aren't really letting yourself enjoy life. You've got to realize then that these are people who have a lot of guilt about pleasure and a lot of guilt about sex, the pleasure of sex.
So allowing people just to be without doing or performing is really the support we need to give them.
Yeah, and I think you need to do a little therapy with them, psychological therapy with them, make them aware of how they function, what their values are.
In the discussion of sexuality, can you describe what sensuality is as opposed to sexuality?
Yeah. Okay. Sensuality is that phase of sexuality where you're building the excitement. And true sexuality is that phase where you're discharging it, releasing. See, so kissing is sensuality, caressing is sensuality, all very beautiful and very important because it builds the excitement, see? But then when you get into the sexual act itself, see, there's a sensual aspect because there's a good deep contact in the sexual act, and that's going to build excitement. But the real satisfaction, pleasure, is when you release, when it lets go.
And where does intimacy come into this definition?
Well, it's a feeling thing. I mean, in other words, if you can feel your partner, feel their bodies, then you're intimate. And if there's no feeling, there's no intimacy, even though you're performing an act. See, the question is whether sex is a way of contact, a way of contacting another person, feeling the the pleasure of dancing together in the act of in sex, you know, or whether you're just performing. Now you can have sex like they do rock and roll. Each partner is not touching each other and doing their thing, or you can have sex as they do it in the waltz, where you're holding the partner in your arms and you're dancing together.
So it's communication.
No, I wouldn't use that word. I would just say it's intimacy.
It's intimacy. In that workshop that you and I did a few years
Yeah.
ago on patients with heart disease, you described their bodies, or their bodies had sort of a typical characteristic to it. Could you just say more about
Yeah.
that?
Yeah.
I think you might have mentioned that in your book on Love, Sex, and the Heart
Yes.
also.
Well, the problem is that people who are vulnerable to heart disease hold their breath. Their chests are inflated. And they're afraid to let go, to give in to a strong excitement. Now, holding against excitement is a tremendous stress to the body, you know. And I can tell you how that would operate in the act of sex itself. But so these are people who are holding back, and at the same time they want the pleasure of sex. They want the release. So what they do is they push, and they force a bit, and trying to make something happen. But here you've got the contradiction where on an unconscious level they're holding themselves in, on the conscious level they're trying to push it out, you know, and the stress is tremendous.
Sounds similar to, if you're talking about type A, you're talking about people who are into performance. So for men who are trying to perform and show what great lovers they are, and as they hold back, hold back, hold back, I would imagine that would, rather than to let go into the orgasm, would create tremendous pressure in their body.
Tremendous, absolutely. In fact, in Freud's time, it was widely believed, and I think there's a lot of truth to it, that one of the causes of heart trouble in men was coitus interruptus. And what happens is the person's building the excitement, and just before he's ready to let go, he jams the brakes on and pulls out. And the doctors were aware that people were having heart trouble. Now, we don't have coitus interruptus quite in that way these days, that people have to withdraw. But they do try to break the excitement. They want to prolong it. So they put the brakes on just as it's building, and it doesn't have as dangerous effect as withdrawal, but it's got a negative effect upon the body.
Yes. Could you make the equation, is it possible to make the equation that the more sex you have, or the more orgasms, I should say, you have, then the stronger your heart?
No, you can't make that equation. The one thing you've got to know about the heart is that it really is an organ of love, and you can't do it. The more you can love the person you're with, the better for your heart. It's as simple as that. The more you can love everybody, better for your heart. Of course, the deepest love is with a sexual partner. Now, if you love that sexual partner, you're going to have great sex. Your heart's going to just sing.
Yeah, if you can let go.
Well, love, yeah.
Yes,
Give
right.
in to the feeling.
Give in to the feeling of love.
Exactly.
Yes.
Not be frightened, you know, that you're going to be sucked into something, that you're going to be burdened. In the show Stop the World, he says, I've been lumbered, L-U-M-B-E-R-E-D, lumbered, meaning that you've been trapped. You know? And people are afraid that if they give in to love feelings, they get trapped. Well, and of course, the heart patient is terrified of being trapped and is trapped.
Or he's terrified about being carried away
Well,
with feeling.
yeah. No, he's also frightened of being trapped. Okay? And he's so afraid of being trapped that he sets up the traps. It's unconscious, but it's the way it works. This goes for women too, of course. The trap was in relation to the mother and father. And every child loves his parents. Say a girl loves her father, a boy loves his mother. And out of that love, they suddenly find that they're being used by the parents. And they're not free. So love has the connotation in their mind that if you love someone, you get trapped. And marriage is a double trap. So they come with that anxiety. So they're afraid to love. But love really sets you free when you're an adult. So in your inability to love, you create the very trap that you're trying to avoid. It's a subtle argument, but you've got to understand psychology works that way. It's like the person who is afraid of being rejected, so doesn't open up and reach out and then gets rejected. So we create our own fate.
Would you say that love is a primary ingredient for orgastic feeling? Or would you say that orgastic feelings come under an interplay with a lot of emotions?
No. Let's be very down to earth. You know, orgasm is a total response, right? A total response is, we can say about a person, he gave it all he's got. He put his heart into it. When you put your heart into anything, you've got a total response, and when you put it in sex, you got an orgasm. It's as simple as that. But anything you put your whole heart into, you're going to have a great feeling.
In a cardiac-prone individual, he's trapped in this because he doesn't want to put his heart into it.
Because then he's going to get hurt, right?
That's right. Or he's afraid to reach out and get rejected.
Yeah.
Or he's afraid to just put his whole heart and soul into the act.
Yeah.
And he's really afraid of being carried away because that's loss of control. And
Yeah.
that's a primary ingredient in a cardiac-prone individual.
Yeah. But the fear of loss of control is the fear that he will be trapped. He will lose control, he can't control the situation, and he'll end up in a trap.
A lot of the issues in childhood with heart disease, especially with heart disease, occur in childhood. Issues of heartbreak, issues of power and control, and issues of love and sexuality are frequently indistinguishable to a young child.
Right. That's
So
right.
where do things get messed up in an early child?
Well, let's say what we know is that a child between the ages of 3 and 6 will have very strong and beautiful sexual feelings for the parent of the opposite sex, but not strong genital feelings. In other words, the whole body is sexually excited. It's not a focused thing, a strongly focused thing. The trouble then is that the parent responds to it with adult sexual feelings. And two things happen. First, the child is overexcited and therefore out of control and doesn't know where this is going to go. Can this end in incest? And it does happen. And so the child has to begin to pull back on his sexual feelings. See? Or is the parent of the same sex going to be jealous of what's going on, which they are, and going to come through with hostility against the child, which happens. So there's a tremendous fear of sex tied up with, but I really love my father or my mother. And here, see what happens. You run into a danger that you're going to be too involved, you're going to lose yourself, they may go into incest, going to go into the danger the other parent will destroy you. So the problem is that the parents overreact to the child's lovely sexual feelings. Fathers get excited by little girls, and mothers get excited by their little boys. The child can't handle that. And if you think that's bad, what about the sexual abuse that goes on, the acting out?
This is crossing a boundary.
Oh, yes.
Obviously crossing a
Yeah,
boundary.
and we know now that at least 1/3 of all children at least have been sexually abused, and people who are really familiar with it say it may go as high as 90%.
And it doesn't have to be the actual
Intercourse, act of
it
penetration,
could be
or
the energy of
well,
of
it's
the
no.
incest.
There's some physical contact in most cases. You take, for example, a mother who gives a boy an enema. I mean, she may think, oh, this is just a health thing, but the symbolism of it is not lost on a child. That it's a penetration, that he has to be in a feminine position, and that his mother is doing something to him, and it undermines his feeling of his own masculinity.
You've talked a lot about men and sexuality and heart disease and having an orgasm, which would help release the pressure in the body. Is there a difference between a woman and her sexuality and her?
Yes, women are more fortunate. They actually have 3 outlets for the release of the tension. Man has only one. Men. See, one outlet, of course, is the normal sexual act where they could have their orgasm, and the second outlet is the birth of a child. That's a tremendous release of tension. And the third outlet is nursing. A lot of tension is released right through the act of nursing because the chest is relaxed. A lot of feeling comes through. We men are really inferior in that sense.
We're in trouble.
Well,
we don't menstruate either, and that's another
That's
form
another
of
form of release, yes. Renewal. On the other hand, we have a strong sexual urge, and if that can be enjoyed, then there's no problem. Nature takes care that, through the evolutionary process, that if people can live their lives naturally, they will also live them healthfully.
I've heard you once say in a workshop that good sex was like having a baby. Is that because when a woman has a baby, there's like a total body involvement?
Sure. Natural childbirth is like an orgastic reaction. Natural childbirth. And the woman has that same sense of fulfillment and pleasure when baby comes out, if it's natural.
One of the things that I learned in my studies of being a psychotherapist is that parents really have the ability to form or deform a child, and they do this unknowingly. Can you comment on that?
It's not so much what the parent does that has a dynamic and major effect upon the child's personality, but who the parent is. I always tell my parents, you don't get apples from a pear tree. Okay? And therefore, the child is a product of who the parent is. Now, when men are passive, like in many homes, you speak to your clients, they say, well, my father was passive, he was out working, my mother ran the house, etc. A boy growing up in that home cannot develop a very natural, healthy aggressive attitude because he patterns himself unconsciously after his father. That's the male role. And where a mother is bitchy, her daughter will become a little bitchy.
So children follow energy of their parents.
Well, they're exposed to their parents, and unconsciously their bodies imitate their parents. The way they walk, the way they move. It's subtle, but that's the basic outcome, So if you want healthy children, you've got to start with healthy parents.
I'd like to ask you both a question. If you had a patient come in who had heart disease, Dr. Lowen and also Dr. Sinatra, how would you go about treating?
Well, the first thing I would do is get him to breathe. I mean, it's cheaper to get to breathe when you're out of the hospital. When you get in the hospital, they give you oxygen. They charge you extra for that. So that's the first thing to get him to breathe. Second thing is to get him to express some feeling, crying. Crying helps you breathe and releases tension. It's the nature's primary mode of tension release. So babies cry so easily. If we can get that person to cry, it's going to be a tremendous relief of the stress around the heart. Will help the heart, will help every other aspect of him too. And finally, he's got to be able to express some anger because that also ties him up. So we work around getting him to start to breathe, to accept the idea that he has a right to cry, that it's good to cry. It's like the rain that comes from heaven. You need that for the flowers to grow. And then to realize he has a right to be angry.
Now, would you work directly or indirectly with opening up his pelvis? Would his crying and being angry allow him to be more sexual?
Well, it helps, but I like to work directly too with the problem of tension in the pelvis.
So you would?
Well, oh, sure.
Yeah.
But you see, you can't do this. You can't say, well, this is the plan you follow with every patient. Therapy is a very personal interaction. You're becoming a substitute parent. So you've got to be sensitive to the person you're working with. You've got to have the quality that a good parent would have. That is, you've got to be a person in your own right with dignity, commanding respect. Be appropriate, all of that. Mm-hmm. And then you can do whatever the situation calls for. What happens is, let's say the therapist has got some infantile qualities and the patient has got some infantile qualities. You're not going to get any real womanhood or manhood out of a therapy situation. It's a big problem we have.
So how would you treat
a patient with heart disease?
Yes, how would you connect it with their sexuality?
I think what Dr. Lowen says is true. The experience of any feeling is the most important thing, and any feeling. And he mentioned sadness, anger, sexual feeling, even the experience of shame, which a lot of these patients tend to cover up. They tend to cover up shame because the typical coronary patient wants to remain in control, and he wants to show that he has no shame or no fear. So I would really try to get this person not only to experience the feeling, but allow him to have their fear. I think acknowledging the fear is very important because a lot of these patients are very afraid and they don't know it. Their false self is a total cover-up of the fear. How would you get them to... well, one of the hardest things I have as a cardiologist is I'll point something out to a patient and they'll think I'm crazy. I say, I don't have any fear. I don't have any sadness. No, I don't get angry.
That's right.
And yet we know the body tells the truth, but the mind is the great liar, So how do you try to, I hate to use the word convince a patient, but just point out to a patient that Yes, you do have a lot of fear. You do have a lot of sadness.
Well, if I told you what I did, I think I would shock you and the rest of your people too.
Well,
I'll tell you what I do. You might as well, because there's nothing I feel one should hide. Suppose we get a man who says, I'm not afraid. Why should I be afraid? You know, the rationalizations. And you know he's frightened because you can see from his body the amount of tension and the holding. What I would do, for example, after I'm sure that we have a good understanding between ourselves, that there's respect and he trusts me, is have him lie down on the floor, and he's now wearing only a pair of shorts. See? As he lies on the floor, he puts his head back so he looks up at the ceiling. Then he puts his feet together and spreads his knees apart so his whole genital area is exposed, and I stand down at the foot of him. And then I say to him, well, are you afraid? He says, no. I suddenly touch him, and he jumps right out of his skin. And he says, yes, I am afraid. Well, that's only one technique.
So it's a technique of eliciting fear.
Yeah. I don't hurt him. I just go like that, and he jumps. It's the one place you can't hide the fear so easily.
The fear and the
well,
grind.
it's castration anxiety.
Yes,
it really is. Sure.
Castrated.
Sure.
He was.
Sure.
Right.
And yet, sensibly, do I castrate people in my office? If I did, how many patients would I have?
That's correct. You'd be out of business
I'd be out
really
of business
quickly.
no time.
Well, actually, what you're describing is really the thing that sets up heart disease later on in life is really the Oedipal triangle, where castration anxiety has occurred at a very early level.
Yeah.
You were discussing this before, but I was wondering if you can elaborate on that. In other words, you take a male, for example, he has a seductive mother and possibly a castrating father,
right.
and he learns to hold on to his sexuality, or he gets the false message that he cannot have his sexuality without either guilt or without annihilation at the other end.
Yeah.
And this sets the stage for heart disease also.
Well,
because
no, that is it. That is the dynamic situation that closes and locks up the heart in a tight chest, you see.
then a $64,000 question is, how do you get one to unlock his heart?
Well, one of the big problems you have in working with people on this level is that you cannot take the responsibility for getting them well. And the reason you can't take it is that since they were hurt by their parents, or say by a father, they're afraid of father, and you are now the substitute father, which is the role that a male therapist would play with a male patient. And now you say, I'm going to try to help you get well. And he's got all this negative feeling about his father. His basic attitude, unconscious, but it's still true, his basic attitude is, damned if I let you do it. That to me, prove that you're better than I am, prove that I need you. So you've got all this unconscious resistance. And my suggestion would be to play it in reverse. Therapy is a great situation for, I don't know, they have a name for this kind of a maneuver, where you come in with a negative attitude and force them to take the positive position.
So in other words, you have to get your client to experience that negativity, get that negativity out.
Well, see, what happens is, if you hold back a bit and he needs you, he's going to start reaching out. If you go in to reach him, then he can push you off. See, these are subtle things one has to know in working with people. So the best way to do it is, with a patient who comes in with heart disease, is to say to him, well, how do you feel about having a vulnerable heart? Are you satisfied with it? Do you want to change it? See, force him to begin to talk about himself, because otherwise he's putting the problem on you. Now, you get me well, doctor.
That's a phrase I've heard frequently, where the responsibility becomes mine, and I really can't do it.
Well, I would say to him, how much is it worth to you to get well? And he'll say, well, I'll pay you, whatever your fee is. But look, we're dealing with your heart. That's not a light subject. Is it worth $50,000 to you? And now you put him on the spot, because if he said no, you figure, so your life isn't worth that much. Maybe you're going to die then.
Unfortunately,
you've got to be a good psychologist at dealing with these patients. You can understand that.
So really unlocking one's heart,
Yeah.
or unlocking the trapped feeling in the cardiac individual, is is really a mammoth task. I mean, it's something that I've struggled with for years.
I think but look at it this way: that every bit of unlocking you do, even though if the door only is ajar a little bit, let some air in and some light in, and can protect the heart. We don't have to transform the person completely. We do have to just let them relax a little more. Each bit of relaxation could protect them. Not forever, but it will help.
So there's a number of factors for the cardiac patient, which is the discharge of feelings, whether it be fear.
Well, how much
anger.
feeling? You say, for example, we'd like you to cry. Every little crying helps. One cry isn't going to save them, isn't going to change them.
So is a cry equivalent to an orgasm?
No. And not every orgasm, every sexual release is an orgastic feeling. You see. So you've got depth of feeling. Some people cry and they only cry off the surface of a feeling. They cry forever and nothing goes. I told you the answer is, and it's very simple. If whatever you do, you put your whole heart into it, you will never have a heart problem. Whatever you do, dance, put your heart into it, man. Make love, put your heart into it. Get angry, put your heart into it. You won't have any trouble. That's the way life should be lived. With heart. See, we put it on a broad level, we have a nice tape. Let them think about it.
And that's correct, because the cardiac person covers up his heart. And he or she are living in a false self. They are hiding from the world, and they don't want to show the world how much passion they really have. It's a total cover-up.
Yeah.
And by getting this individual to experience their heart, or experience fuller life, you actually can help prevent
Oh, you will, no doubt about it.
feelings of heart disease, or the occurrence of heart
Sure.
disease. I have a final question I'd like you to go into, and a lot of my cardiac patients, particularly my male cardiac patients, describe an inability to have sexual feeling. In other words, and they'll come in with me with all sorts of stories, impotency problems, lack of feeling, lack of energy, which you talked about, lack of desire. And a lot of these men, most of them are men that...
And what age bracket would you say
Some of them are young, ages 35 to 65, usually around 50. This is usually the age where the sexual desire really falls off. Mm-hmm. And as their physician and cardiologist, and in some instances their therapist, I want to support them in having feeling. And the magic is how do you get an individual started?
Well, let me say
in enhancing their sexual feeling and sexuality.
Let me say this, that a lot of the sex that they engaged in earlier had a compulsive quality. And since it wasn't that satisfactory because it was compulsive, the feeling dies out naturally. And that's a good thing, because when the feeling dies out, you can't be compulsive anymore. Now if you have the faith to wait until your real feeling comes through, it'll come back nicely with a new quality, and you'll enjoy your sex more. And that happens in therapy. A lot of the men, as they get in therapy and learn to let go, their sexuality becomes less compulsive, and suddenly they say, well, I couldn't maintain the erection. What's the big problem? You weren't that hungry. You'll get hungry, just wait. So they need to have some faith in the natural processes rather than in the willing everything.
Well, things may get worse before they get better.
Well, it isn't worse. After all, if you're not hungry, there's nothing terrible about that. See, what they do is all they've lost is the performance. They haven't lost any real pleasure. And if you wait till you get hungry, then your meal is going to taste great.
Well
Desire
put.
is natural.
Trust the body.
Trust the body. I think that if the doctors would trust the body more, then these people would go willingly along the line you suggest. They need an authority to say, trust the body. Because they've learned all along that, oh my God, something's happening. You got to do something about it. Which isn't true.
And that's a problem for the coronary prone individual, because they're so wired up into performance that they constantly have to do something to make things happen. And the thing to do is not do anything
That's
and just let it happen.
Yeah.
Let the body and its natural tendency or its natural energy take over.
Now, let me just give you an example. Patients will say, well, if I stop running, pushing, working hard, I'll do nothing. I'll be just lying on a bed. I say, okay. Let's say you stop, and you're going to lie on that bed. How long do you think you'll lie there before you have to go to the bathroom? How long do you think you'll lie there before you get hungry? I mean, feelings will start to move you. What you're doing is you're rushing so fast to avoid the feelings.
So the message to my cardiac patients is slow down, smell the flowers.
Cougar has a song, take it easy, take it easy. It's a rumba, beautiful song. One of the things about sex is, and this is very important, is that men, and this is primarily a male problem, are frightened of two things, really terrified. One that they'll come too fast, the other is they won't come fast enough. They'll be too late. Between those fears, they're not going to have much pleasure out of the act.
Get out of your head, get down into your body.
So the motto has to be, let it happen.
And those are great closing words for the tape.
Yeah. Thank you very much.